This presentation is practical breathing exercises to help with long COVID and also what to look out for. What's the expected progress? How would you help to determine your progress? And various considerations with that. We will also be joined by Vikki Armstrong, who has been dealing with long COVID for about 14 months. And she will talk about her journey and the exercises, etc., that she has practiced. And of course, the experience that she has met. My name is Patrick McKeown, and the technique will be taken from the Buteyko Clinic method and also from the oxygen advantage. I'm going to start off with sharing a screen and looking at what symptoms are involved with long COVID. These symptoms typically are persisting, as I said, for several months after the onset of infection. Shortness of breath. So a common denominator here is that people have difficulty even talking, putting sentences together. And we use breath hold time as a measurement of progress, or at least to give us some feedback of the degree of functional breathing patterns. People with a high shortness of breath or strong shortness of breath will have a reduced breath hold time during rest. We can use breath hold time to gauge the degree of breathlessness during rest. And that will also provide an insight of breathlessness during physical exercise, and also how fast and hard the person is breathing during sleep. Another feature of long COVID can be tachycardia, and this is when the heartbeat is elevated to up to 180 beats per minute, even as a result of sitting or standing as a result of postural orthostatic syndrome, tachycardia syndrome. A feature can be chest pain, fatigue, dizziness, syncope at exertion, passing out in exertion, and brain fog. Many of these symptoms, they really remind us of people with chronic fatigue syndrome over the years, that the central nervous system, that the entire nervous system is so taxed, and the progress that we make with doing the breathing exercises, it's a very gentle and it's a very, very slow response and progress, because if we go too quickly, it can be overtaxing on the individual and it can set them back. So the real primary message here is that the breathing exercises need to be tailored to the individual's breathing pattern and for the person to go very, very gentle. The condition is overwhelmingly affecting women aged between 20 and 50 years. And prior to infection, many of these patients had good health. And I've seen athletes, I've seen really, really healthy women, doing lots of physical exercise, etc., and dealing with long COVID. So tests post-infection are usually coming back negative. And just to bear that in mind. Sorry, I'm still letting people in and I'm just moving on through. So the unfortunate thing with long COVID is that you don't know where it's going, and people can be taking one step forward and two steps back, and they don't know if what's going to trigger relapse or when it will happen. And everybody is different. And as Vikki described, it's a 14-month roller coaster. So you can imagine that this is going to bring on a lot of anxiety. And with that, it's going to change breathing patterns. Breathing is going to become faster and shallower. So you have a condition that's feeding into fast and shallow breathing, but you also have the associated anxiety with it, which is contributing to fast and shallow breathing. Fast and shallow breathing is a normal response to the feeling of suffocation. But when one is feeling suffocated, it is entirely the worst way to breathe, because it's inefficient and it's not economical. And we'll go through that. How to breathe to improve blood oxygen saturation. And it's just based on normal physiology. So the control pause is a measurement that we use to assess people's functional breathing patterns. And what I would like you to do is I would like you to measure your own control pause. This is also called the Bolt score from the oxygen advantage. It's the length of comfortable breath hold time. And to measure your control pause, you just need a timer. The measurement goes as follows. You take a normal breath in and out through your nose, and you pinch your nose with your fingers and you stop breathing. it's not the length of a maximum breath hold. So to measure your control pause, you have normal breathing in and out through the nose. Then take a normal breath in through your nose, a normal breath out through your nose. Pinch your nose with your fingers and time it in seconds. How long does it take until you feel the first definite desire to breathe? And then to let go and to resume normal breathing. So it's very important that your breathing following the breath hold is normal, that you're not out of breath. And if you find that you have to take big breaths or you have exaggerated breathing following the stopping of the breath, well, then you've pushed it a little bit too far. We have seen quite a number of people with long COVID having breath hold times of as low as 3 seconds. The significance of this is that you can track your breathing patterns and you can track your degree of breathlessness by virtue of your breath hold time during wakefulness. So anytime that you want to assess your breathing patterns, sit down for about 5 minutes, take a normal breath in and out through your nose, pinch your nose with your fingers, and time it in seconds until you feel the first definite desire to breathe or the first involuntary movement of your breathing muscles, and then let go and to breathe in through your nose, and your breath upon the resumption of breathing should be normal. A functional breathing pattern is when the breath hold time is greater than 25 seconds. And as I said, many people have, with long COVID, have a breath hold time of as low as 3 seconds. The lower your breath hold time, the greater the feelings of suffocation. And the more breathing is labored. So your breathing is harder and faster. It will involve a significant effort to breathe. It's also upper chest breathing, irregular breathing, and hyperventilation. So, for example, people with a breath hold time of between 3 to 10 seconds, their breathing is going to be quite labored, and many of the breathing exercises that we would have practiced traditionally won't be suitable to them. So instead, we have to give them breathing recovery exercises, very gentle exercises. And the key here is the lower your breath hold time and the more labored your breathing, the lighter the dose. In other words, go very easy with the exercises, but do them frequently. So don't spend so much time doing them, but when you do them, to do them frequently. So I'm just going to move on. And the control pause or the Bolt score or the breath hold time, it must be that it depends on your Bolt score, but the breathing exercises must be so gentle so that they do not tax the nervous and cardiovascular systems. And it's a short dose and short duration of air hunger is necessary. Most cannot do physical exercise, and they cannot do physical exercise because of POTS. So, and also if you have a breath hold time of about 3 or 4 seconds, you are going to be too breathless during physical exercise. And as a result, you're much better off just doing the breathing exercises sitting. A key aspect of this is that when you finish a session, you should be able to do that whole session again. So whenever you finish a session, you should have enough energy that you can continue to do the session. And so that's really about as well, listening to your body and paying attention to it and going very, very gentle. And I said earlier on that, you know, when I was working with people with chronic fatigue syndrome over the years, that if we went in too strongly with the exercises, it would cause so much fatigue and it would set people back. And it's the exact same thing we're going here. I have a feeling, and also the reports from people who are working with long COVID, is that some people or many people, we don't know for sure, but that people who can be infected with long COVID are type A personalities and very much in a sympathetic activation, go, go, go. So they're go-getters. And that the nervous system can be tipped into that more kind of fight or flight response as a result of society and everything else. Now, of course, when you're a type A personality and you're go, go, you're going to use the same approach when you have something such as long COVID, and there's a chance that you can put too much effort in. So it's very important. Another aspect of this is the central nervous system and the autonomic nervous system, that we achieve a balance, and we achieve a balance between relaxation and stress. So for example, when you have a persistent condition, either if you are physically or mentally unwell, that you can be in that overstimulation or hyperactive arousal. And what we want to do is we want to dampen the stress response, and we want to activate the body's relaxation response. And we also want to stimulate the vagus nerve. And by doing that, we can help with recovery, because we can help to bring a balance in the autonomic nervous system. So that's where these exercises are going. The controlled pause, if you find that your breath hold time reduces, and we described your breath hold time as being the length of your comfortable breath hold time, if it's reducing, then make an adjustment to your routine for that day, because, you know, paying attention to it, that if you find, for example, that you're a little bit fatigued, or your breathing has deteriorated, because this is normal. You know, as I said, one step forward and two steps back. That when you find that your breathing is not up to par, or your breathing pattern has got a little bit worse, will then decrease the duration of the breathing session, but increase the frequency of it. And these are the exercises that I'll go through. So just bear with me for a little while here. Breathing recovery exercise, to do it for during sitting, maybe 1 to 3 minutes every hour, or pay attention, you know, to how you are feeling, and to bear in mind that when you're finished a session, you should be able to do that session again. So don't push yourself to the point that you're pretty much taxed as a result of it. Another exercise to do could be breathe light for 30 seconds, 1 minute, breathe light for 30 seconds. So you have air hunger, 1 minute's rest, breathe light for 30 seconds, 1 minute's rest, and practice this for 5 minutes every hour. So again, using your breath hold time as a measure of your progress. And if your breath hold time if it's decreasing, go easier with the exercises, but do them more frequently. The controlled pause, or the body oxygen level test, we want to increase it by practicing the breathing exercise, and also to measure breath hold time before and after. So if you do a series of breathing exercises, you want to check, has your breath hold time increased as a result of doing the breathing exercise? And ideally it does. And so again, it's you know, it's not just about your breath hold time as a measurement of your progress, but it's also about how effortful is your breathing, what's the speed of your breathing, how hard and fast are you breathing, are you upper chest breathing, and how suffocated do you feel, how breathless are you? This is the progress, and this was taken from somebody who has long COVID, and you see that the time here is in months. So unfortunately, it's a long haul. And again, it reminds me of chronic fatigue syndrome. People with severe chronic fatigue syndrome, we would always say that you have to give it about 6 months or so. Now, you could make progress a lot quicker than that, but you have to give it the time. Whereas people with asthma coming in, we could expect a lot quicker progress in terms of people feeling a difference quite quickly, you know, a lot sooner. So you see here that the controlled pause, or the BOLT score, which is your breath hold time, you'll see that it's making some progress. You'll have a dip, and it's making progress. You have a dip. In other words, it's not linear, that you're going to have ups and downs. And the objective that we want is to improve your BOLT score, but also to improve your breath control. And this is very, very important. And we do that by restoring nasal breathing. The nose is the only organ in the human body that does any role in terms of the breath, and our mouth does absolutely nothing. So for example, when people talk about breathing and people ask the question, well, should I be breathing in and out through my nose, or should I be breathing in through my nose and out through my mouth, etc.? You have to bear in mind that your mouth performs absolutely no function whatsoever in terms of the breath, that it's all performed by the nose. So it's really, really important that you continue with nasal breathing, even if you're feeling that you have air hunger and you're feeling that your breathing is labored, don't switch to mouth breathing to alleviate the feeling of air hunger. Make sure you continue to breathe in and out through the nose, because that's very, very important. I'm just conscious that there's many people waiting to come in, and I'm trying to let them in, but for some reason they are not coming in. So just a small distraction here at this end. The first exercise that I'm going to start off with is the breathing recovery exercise. And the breathing recovery exercise is going as follows. The whole key about the breathing recovery exercise is only hold your breath for half your control pause or bolt score at that time. So this is a pretty important point. When, for example, I was working with individuals with a breath hold time of 3 seconds, how would you expect them to breathe? Well, their breathing is going to be very fast. Their breathing is going to be shallow. Breathing is going to be upper chest. So they already have air hunger and they are already feeling suffocated. Now, if I asked them to breathe in for 4 seconds and out for 6 seconds, it's not going to happen, because you cannot do it if you're already feeling air hunger. But what we do instead is we do many small breath holds. And this exercise goes as follows. You take a normal breath in and out through your nose. You pinch your nose with your fingers to hold your breath, and you stop breathing for half your control pause or half your bolt score. So if your control pause is 3 seconds, well, then your breath hold during the exercise is only for about 2 seconds or so. In other words, you don't want to hold your breath. That causes you to lose control of your breathing at this point here. So I'm going to start off with that exercise, and we're going to do that for a couple of minutes. And, as I said, listen to your body as well. You don't want to push it to the point that you're losing control of your breathing. And it is a fairly easy exercise. So the exercise goes as follows. Take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. 1, 2, let go, breathe in through your nose, and to breathe normal for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 1, 2, let go, breathe in through your nose, and breathe normal for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 1, 2, let go, breathe in through your nose, and to breathe normal for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 1, 2, let go, breathe in through your nose, and to breathe normal for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 1, 2, let go, breathe in through your nose, and to breathe normal for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold. 1, 2, let go, breathe in through your nose, and breathe normal for 10 to 15 seconds. So the whole key with this exercise is to do the exercise and to do it frequently and to do it often. So maybe, for example, 1 to 3 minutes, you could do it 1 to 3 minutes every hour, or 1 to 3 minutes every half hour, depending on your breath hold time. If your breath hold time is very low, as I said, 3-4 seconds, only hold it for half your breath hold time at that time. So the objective is restoring nasal breathing. We spoke about that. Light breathing we're going to practice. We're going to talk about humming, slow breathing, and low breathing. And hydration, of course, is a necessary feature. Now, during the light breathing, it can be normal that your blood oxygen saturation drops a little bit. And this is because of the increase of carbon dioxide in the blood. In other words, when you reduce the volume of air that you breathe, there is a gas called carbon dioxide that increases in your blood because it cannot leave your body so quickly through the lungs. And it's the gas carbon dioxide that generates the feeling of air hunger. So the feeling of air hunger that's occurring as a result of breathing less air is due to an accumulation of carbon dioxide. Now, when carbon dioxide increases in the blood, the affinity of hemoglobin for oxygen reduces. So hemoglobin starts to release oxygen more readily. And this can cause a drop in the blood oxygen saturation. So what I would say is that when you are doing the gentle reduced volume breathing exercises, if you see your blood oxygen saturation dropping a little bit, it's normal. And we would see this with a normal individual, not infected, say, for example, or not recovering from long COVID, that if the blood oxygen saturation as measured by pulse oximetry, if it's normal at 97%, then we would see that the SpO2 would drop down to about 95% during the reduced volume breathing. So if you see a drop to your blood oxygen saturation during the reduced volume breathing, it's normal. The suggested program, you measured your breath hold time earlier on, And if your breath hold time is between 3 and 10 seconds, well, your breathing is quite effortful and labored. It's very important for you to measure your Bolt score every morning after waking. Keep an eye on your Bolt score. Keep an eye on your breath hold time. And the main exercise is breathing recovery sitting. And the breath hold should be no longer than half your Bolt score. We spoke about this. During week 1, I suggest about 3 to 5 minutes every hour. And week 2 onwards to practice 5 to 10 minutes every hour. In other words, increase the duration of the exercise from week 2 onwards. And I am sticking with this exercise because it's the best exercise to do when your Bolt score is so low. There are wonderful breathing exercises, but they are not going to be suitable when your breathing is so labored. Because even breathing in for 4 seconds and out for 6 seconds, reducing the respiratory rate down to 6 breaths per minute, it all makes sense. And in theory, of course, and in practice for many people, it's a wonderful exercise, not for this group. So stick with your small little breath holds. The small little breath holds will help to bring a calmness to your breathing. They also help to harness nasal nitric oxide, because as you breathe in and out and hold your nose, 1, 2, nitric oxide is pulling a little in the nasal cavity. And then when you let go of your nose, you're carrying this nitric oxide and you're drawing it into your lungs. And nitric oxide is a bronchodilator and it helps to open up the airways, but it's also antiviral and it's antibacterial. So it's a very important gas that's produced in the nasal sinuses, and it also helps to redistribute blood throughout the lungs. Nose breathing too will increase the pressure of oxygen in the blood, and it's known to increase it by about 10%. So even though you are feeling breathless, you're feeling suffocated, don't open your mouth, because mouth breathing involves fast and shallow breathing, and it's not ideal in terms of gas exchange taking place. In other words, oxygen taking place from the lungs into the blood. So if possible, with your low breath hold time, practice nose, slow and low breathing. And the reason being is because if we were to look at the human lungs, so say, for example, and I'm not going to have a great diagram here, the greatest concentration of blood flow is in the lower lobes of the lungs. But if you're breathing through an open mouth, you typically breathe fast and shallow. And it is normal when your Bolt scores are so low that you breathe fast and shallow. There's a poor gas exchange taking place here. By switching to nose breathing, you harness nasal nitric oxide, and nasal nitric oxide will help to redistribute the blood throughout the lungs. But also by practicing low and slow, you help to redistribute the air throughout the lungs. And it's not about breathing more air. It's also about, when we're thinking of breath itself, we have to think of the respiratory rate, which is the number of breaths per minute, multiplied by the tidal volume, which is the air drawn into the lungs during one breath, to give us minute ventilation, which is the volume of air breathed in 1 minute. And if I give you this example here, imagine you're breathing 20 breaths per minute and the tidal volume is 300 ml. You're bringing in 6 liters of air into the body. But of this 6 liters, how much of this air actually gets down into the small air sacs in the lungs for gas exchange to take place? To find out, we have to subtract dead space. And dead space is the air that remains in your nasal cavity, in the throat, in the trachea, in the bronchi, in the bronchioles. So with the same example here, we have 300 ml, subtract 150 ml, which is dead space. And to find out how much air is getting down into the small air sacs in the lungs, the answer here in this instance is 3 liters. In other words, if you're breathing fast and shallow, in this example, 50% of the air drawn into the body is left in dead space. That's why fast and shallow breathing is not ideal. As I said, it's inefficient. So nose, slow and low is a great mantra. And I know it's not the easiest to do, but what you want to do is you want to do the small breath hold exercise very frequently and throughout the day to build up your Bolt score, to build up your breath hold time. And when your breath hold time gets to closer to 10 seconds, then it's a lot easier to practice nose, slow and low breathing. Now, you can start off easy. You don't have to, for example, practice breathing in for 5 seconds and out for 5. You could practice breathing in for 2 seconds and out for 2 seconds, or in for 3 seconds and out for 3 seconds. In other words, it's the degree to which you were able to slow down your breathing is going to improve breathing efficiency. And if you were breathing in for 3 seconds and out for 3 seconds, so for example, you slow down the respiratory rate to 10 breaths per minute, and the tidal volume you allow to increase proportionately to 600 mil, it still gives you 6 liters as before. So minute ventilation is 6 liters. But now if we look at the volume of air that's reached the small air sacs in the lungs, and we subtract dead space, which is 150, you see in this instance that minute ventilation has increased to 4.5 liters simply by changing the respiratory rate, even though we kept minute ventilation the same. So always kind of have that idea in your head. Anytime you're caught for breath, try not to breathe fast and shallow, regardless of whether it's long COVID or any other condition that you have, or even anxiety and panic disorder. Always the mantra is nose, slow and low. To breathe in for 3 seconds and out for 3 seconds, ideally is to have your hands either side of your lower ribs. So your main breathing muscle is separated just at the base of the ribs. You can't really feel it, but you can feel the base of your ribs here. And to put your hands either side of your lower ribs. And then as you breathe in, you should feel the lower ribs gently moving outwards. And as you breathe out, you should feel your lower ribs gently moving in. And you could be breathing in for 3 seconds to breathe in, 2, 3, out, 2, 3, 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 in, 2, 3, out, 2, 3. So slowing down the speed of your breathing is advantageous, and it's advantageous for that reason. You get a better gas exchange taking place. You've got a better transfer of oxygen from the lungs into the blood. Now, breathing light is very important because, of course, breathing is not just about the speed of your breathing. It's not just about the depth of your breathing, but it's also about the biochemistry. And the biochemistry, it's often a dimension that's overlooked, and it's very unfortunate because if you have a habit of breathing too hard and too fast, you get rid of too much carbon dioxide from the blood through the lungs. And what happens then is that it can increase your sensitivity to the buildup of the gas. In other words, the primary stimulus to breathe this carbon dioxide is not oxygen, unless your oxygen levels drop to about half. So every breath that you take is driven by a buildup of the gas carbon dioxide. But if we are overly sensitive to the accumulation of carbon dioxide, it means that our breathing can be hard and fast. We want to help to slow down our breathing and to reduce the respiratory rate and to achieve normal minute ventilation. And the whole mantra here would be light, slow, and deep breathing. And we do that by doing these simple exercises. So what I would like you to do is to put one hand on your chest and one hand just above your navel. And this is the Breathe Light exercise from the Oxygen Advantage book or from the other books. And to have your attention on your breathing, you're focusing your attention coming into your nose. And as you breathe in through your nose, really slow down the speed of the air coming into your nostrils. And at the top of the breath, have a total feeling of relaxation and a slow and a gentle exhalation. Now you will see that this breathing exercise could be challenging for people with a very low breath hold time. And that's why we start off with the small breath holds. And once again, the objective of this exercise is to take a very soft and slow, gentle breath coming into your nose and a really relaxed and a slow and a gentle exhalation. A very soft and gentle breath coming into your nose and a really relaxed and a slow and a gentle exhalation. A very soft and gentle breath as it enters the nostrils and a really relaxed and a slow and gentle exhalation. You are doing this correctly if the volume of air drawn into your lungs is less than what it was before you started. And you know that you're doing it correctly if you feel air hunger. Air hunger is not signifying that your oxygen has dropped, but it's signifying that carbon dioxide levels have increased. So when you breathe less air, carbon dioxide increases in the blood because it cannot leave the body so quickly through the lungs. And as carbon dioxide increases in the blood, you feel air hunger. But it's very important to expose your body to the feeling of air hunger, because this then reduces what's called the ventilatory response to carbon dioxide. So it's kind of ironic, but by practicing breathing less air, in the long term, you're able to slow down your breathing and breathe light. So oftentimes the drive to breathe, that fast and harder breathing pattern, is driven by an intolerance to the buildup of carbon dioxide. So if you have a strong response to the accumulation of carbon dioxide, your breathing will typically be harder and faster breathing, and harder and faster breathing during rest, harder and faster breathing during exercise, and harder and faster breathing during sleep. So by breathing less air, you increase carbon dioxide. Now, you might notice a few things happening with this. Just pay attention to the saliva in your mouth. Is it less, more, or the same? When you breathe slightly less air and you're feeling air hunger, and an air hunger that's tolerable, it shouldn't be stressful. And the air hunger shouldn't be so strong to cause involuntary contractions of the diaphragm. In other words, that you should maintain good breathing control during the air hunger. It stimulates the vagus nerve. And by stimulating the vagus nerve, this is a nerve that's wandering throughout the human body, and it's innervating most of the major organs. 80 to 90% of the nerves is from the body up to the brain. And by stimulating the vagus nerve, it secretes a neurotransmitter called acetylcholine, which causes a slowing of the heart. And when the heart rate slows down, the brain interprets that the body is safe. And the brain in turn will send signals of calm to the body. So stimulating the vagus nerve will help to bring a balance in the autonomic nervous system. It helps dampen that stress response. And overactivation or hyperarousal can be a common feature of people with long COVID. So we want to achieve a balance. We want to dampen the stress response. We want to increase the relaxation response. And also by doing this exercise and by breathing slow and by breathing low, we can help to strengthen or to make more sensitive the baroreceptors, which are pressure receptors in the major blood vessels. The sensitivity of your baroreflex is a very important indicator of how well your autonomic nervous system is functioning. So when you think of the autonomic nervous system being taxed with people with long COVID, well, it's very important that we're able to target specifically, and we can do that via breathing exercises. But of course, the whole thing about this is to go very gentle. Depending on your Bolt score, depending on your breath hold time, the lower your breath hold time, as I said, the more gently you go with the exercises, but the more frequently you do it. So I'm going to go back to the to the slides. And we spoke about breathing in for 3 seconds and out for 3 seconds with your hands and your lower ribs, and breathing low with very little movement of the chest. And go gentle with this. It's not about feeling a strong sensation of air hunger. It's not about getting stressed when you're doing it, but it's just gently working with it. And if you can, breathe in for 3 seconds and breathe out for 3 seconds. And the only reason that I've put down 3 seconds in and out, a breath every 6 seconds or 10 breaths per minute. It's because the Bolt score is between 3 and 10 seconds. Now, with a higher Bolt score, so you're practicing doing the breath hold exercise, the small breath hold exercises, and as your breath hold time, your Bolt score starts to increase, then you can spend a little bit more time doing exercises. A common feature of long COVID and also with COVID is that the nose is congested, and you can decongest your nose by holding the breath. The exercise to help decongest the nose is as follows. Now, you can get an idea of how open or closed your nose is by just using the screen on your mobile phone, and just place the screen underneath your nose, close your mouth, and breathe onto it. And you will see that a halo is left on the screen. You will notice that a halo might be more on one side than the other, indicating that one side of your nose is a little bit more stuffy than the other. To help open up your nose, you can do the following exercise. Bear in mind, don't do this if you're pregnant or if you have serious medical conditions, but also if your breathing is very labored, you have to go easy. You don't want to hold your breath for too long, that it causes you to lose control of your breathing at the end. This exercise to decongest the nose is as follows. Take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. And as you hold your nose, gently hold your breath and nod your head up and down. Don't hold it for too long that you lose control of your breathing. Because again, depending on your Bolt score, but we have used this with many people with COVID, and the feedback is that it works. Now, that exercise will only temporarily decongest your nose until you get your breath hold time higher. So I would also say to students, if you are suffering from nasal congestion, and this may be just, you could have, rhinitis, that your nose is blocked for 1 hour a day, most days of the year, that when you do the nose unblocking exercise, which involves taking a normal breath in and out through your nose and holding your breath for a relatively long time until you feel a moderate to strong air hunger, but letting go and resume breathing in and out through your nose with good breath control. This exercise will temporarily decongest your nose. But when you get your Bolt score or your breath hold time above 20 seconds, your nose is more permanently free. So the whole objective here is to use this exercise anytime your nose gets stuffy, but keep working on your Bolt score. And as you increase your Bolt score, you will find that your symptoms of the nose are much less. And I'm talking about rhinitis here. I'm talking about inflammation of the nose, runny nose, etc. And the problem with a stuffy nose is that if you have a stuffy nose, your sleep is impacted. So it has been known that people with nasal obstruction, they are 2 to 3 times more likely to have moderate to severe sleep disordered breathing. So I'm just going to move down here again. So here, this is still a Bolt score of between 3 to 10 seconds continued, and using the nose unblocking exercise while sitting. Humming also with slightly prolonged exhalation. Humming is an excellent exercise to help stimulate the vagus nerve, but also to harness nasal nitric oxide. And the way to do this would be take a very soft breath in through your nose and then just gently hum on the exhalation. But after you hum on the exhalation, make sure you breathe back in through your nose. Now, bear in mind, if your Bolt score is very low, again, this is going to be challenging, but just do your best with it. So even if you were just to take a breath in through your nose and then hum on the exhalation, but after that, make sure that you breathe in through your nose. And if you were to do that several times every hour, the humming will help to vibrate the nasal passages, but also nitric oxide, which is pooling in the paranasal sinuses, is emptied into the nasal cavity, so that when you breathe through your nose, you're carrying this nitric oxide into your lungs. And nitric oxide is antiviral, as I said earlier on, it's antibacterial, and it helps to redistribute the blood throughout the lungs. So coming back to this, relaxation is also very important when your Bolt score is quite low and you want to help improve or to get a balance in the autonomic nervous system. You can download a free 20-minute relaxation from the Buteyko Clinic app, which is available on Android or iTunes. Another aspect is to sleep in a well-ventilated room, and also to make sure that your mouth is closed during sleep. It's very, very important. Now, the tape that I refer to here is called MyoTape, which is my own tape. The reason that I've referred to this tape here is because the tape, it surrounds your mouth and it doesn't actually go across the lips, because if your breath hold time is between 3 and 10 seconds, it would be normal that you would feel apprehensive about putting a tape across your lips because of the air hunger. But if you start off during the day by having a tape surrounding the mouth, it will get you used to more nasal breathing and then to practice it during sleep. You should never wake up with a dry mouth in the morning, and that goes for any of us. As I said earlier on, it comes back to what are the functions of the nose versus the mouth. Does the mouth have any function? And the answer is no. When it comes to breathing, it has 0 functions. It doesn't moisten, it doesn't warm the air, it doesn't regulate volume, it doesn't do anything. And mouth breathing is typically activating the upper chest and it's faster and harder breathing. And also, when you breathe through your mouth during physical exercise, you're more likely, for example, to exercise-induced bronchoconstriction. You would have less oxygen transfer from the lungs into the blood, and also less oxygen transfer from the blood to the tissues. Because when you do your physical exercise with the mouth closed, carbon dioxide increases a little in the blood, and you will feel this by virtue of air hunger. And this, of course, depends on the intensity of your exercise. But as carbon dioxide increases in the blood, hemoglobin releases oxygen more readily. So my point here is that carbon dioxide is not just a waste gas that people often say. It's not just a simple breathe in as much oxygen as you can and get rid of this waste gas, carbon dioxide. In actual fact, the release of oxygen from the red blood cells to the tissues and organs, that carbon dioxide plays a role there. That as carbon dioxide increases in the blood, blood pH drops, and hemoglobin, which is the main carrier of oxygen in the blood, hemoglobin releases oxygen more readily. And this is called the Bohr effect. So we're coming back to Bolt score still of between 3 and 10 seconds. And I'll do a recap on this because this is very challenging for any person experiencing this. And, you know, if your Bolt score or your breath hold time is as low as 3 seconds, you will barely be able to string a sentence. And that's why it's very important that we tailor the breathing exercises here, both the dose of the breathing exercises, but also the duration. The expected progress here is to increase your Bolt score to above 10 seconds in about 2 to 4 weeks. And I've kind of kept it open-ended, that it's a very slow progress. And just to bear in mind that, yes, you might have some progress and then you might have some setbacks. So just a quick recap: when your Bolt score is really, really low, because this is a common feature of long COVID, measure your Bolt score every morning after waking. Practice the breathing recovery sitting exercise, but your breath hold time should be no longer than half your Bolt score. So if your Bolt score is 3 seconds, your breath hold time should be about 2 seconds. During week 1, practice 3 to 5 minutes every hour. Now, if you feel more comfortable doing 5 to 10 minutes every hour, then do that. But listen to your body. And remember what we said at the start. Once you finish the session, you should feel that you have enough energy to do that session again. In other words, don't push yourself to the limit. Week 2 onwards, practice 5 to 10 minutes every hour. And again, I've left it quite open-ended here so that you can choose depending on how you're feeling at that time. If possible, gentle nose, slow and low breathing. It's really important. Try not to breathe through your mouth, even if you're feeling breathless, because mouth breathing is just, you know, it's ironic that when we are feeling suffocated, we revert to mouth breathing and fast and shallow breathing. But mouth fast and shallow breathing is absolutely the worst way to help alleviate the feelings of suffocation. If you switch to nose, slow and low breathing and gently slow down your breath, you may not be able to slow it down too much, but do your best. And another aspect of slowing down the breath is if you can prolong the exhalation, you help to bring the body into relaxation. So if you think of it in terms of the stress response in the human body, whenever we get stressed, our breathing becomes faster, and especially the exhalation. Whereas if we take, you know, when we're stressed, our breathing is harder and faster. And if we want to activate the body's relaxation response, always think of the exhalation, not so much the inhalation. As you draw air into your nose, the vagus nerve steps back a little bit. So the inhalation is more under the control of the stress response, the sympathetic nervous system. And the exhalation is primarily under the control of the body's relaxation response, the parasympathetic nervous system. If you take a soft breath in through your nose, it could be fast or it could be slow, but typically we say go slow. As I said, the inhalation doesn't matter too much. So the inhalation is in through your nose. We'd say a soft breath in through your nose. And then if you have a really relaxed and a slow, gentle breath out through your nose, the relaxed and slow, gentle exhalation, that stimulates the vagus nerve. So anytime if you're feeling stressed during the day, always bring your attention onto your breathing and use this. And even if you do this for about 90 seconds, it will help to alleviate stress because you will start to feel calmer. It's a really, really good trick to do. And you're taking a very soft breath coming into your nose and a really relaxed and a slow and gentle exhalation, because when you breathe out slow and relaxed, you are telling the brain that everything is okay. And when the brain senses that everything is okay, the brain will send signals of calm. But if you're breathing in fast and out fast, and this is the problem as well, when we have a very low breath hold time and we have fast and labored breathing, that we are more likely to be in hyperarousal because our breathing is fast and shallow and through the mouth. So you have the physiology of fast, shallow breathing kicking in an anxiety response. And of course, we also have with long COVID that people don't know where this is going. They don't know what's going to trigger them or when they could be triggered. So you have anxiety from that aspect of it. And anxiety then is going to make breathing harder and faster, which in turn is going to feed back into the hyperarousal of the nervous system. So always try and do your best to gently soften the breath, nose, slow and low. Now, as your bolt score increases, so we went, I'm just doing a recovery, not a recovery, but a refresher here. Use the nose unblocking exercise while you're sitting. And humming with a slightly prolonged exhalation with breath control is very important to help stimulate the vagus nerve. And you can be doing this really whenever you feel like it. You know, I said 1 minute, 10 minutes daily, but, you know, I don't think it's taxing to hum every now and again. And the other thing about humming is that it will help to extend the exhalation, which activates the body's relaxation response. Relaxation upon waking and before sleep is very, very important. Sleep in a well-ventilated room, wear myotape during sleep, and the expected progress we spoke about. Now, when your bolt score then is improving, your breathing is becoming a little bit lighter and you've got better control. So now you could increase the dose of the exercises, but I've kept the exercises pretty much the same. The breathing recovery sitting, you could be practicing this now for 5 to 10 minutes, 3 times daily. But I would also bring in the breathe light exercises, air hunger. So one is hands on chest and tummy, which I did earlier. The next exercise is what I'm going to do now, is the finger underneath the nose. And this is helping to breathe light. And when I talk about breathe light with air hunger, this is about increasing carbon dioxide in the blood and exposing your body to the increased carbon dioxide to help reduce the ventilatory response to carbon dioxide. In other words, that your breathing becomes lighter. So you deliberately breathe less air. And in the long term, then your breathing becomes more comfortable, more under your control, and you'll find it a lot easier to breathe in and out through your nose because you won't feel air hunger. You know, it's normal that if you have a very low bolt score, it's normal that you will feel air hunger. How do you alleviate the air hunger? Well, you practice breathing exercises to breathe less air, which initially will generate air hunger. But by generating that air hunger, by doing the exercises, it helps you to improve your breathing patterns so that your everyday breathing, you don't have that air hunger. And you will know by virtue of the improvement of your bolt score. Every time your bolt score or your control pause increases by 5 seconds, air hunger is decreasing. So just bear that in mind. The finger underneath nostril is simply you have your finger underneath your nose as follows, and you're placing your attention on the airflow coming onto your finger. You're taking a very soft, slow, gentle breath coming into your nose and a really relaxed and a slow and gentle breath out. And I would like you to practice this. I would like you to breathe a little bit less air. You're taking a very soft, gentle breath coming into your nose and a really relaxed and a slow and gentle breath out through your nose. Your finger is a good barometer of the airflow coming out of the nose. Can you breathe so gently, almost that you feel hardly any air coming onto your finger? And also use this as a measure of your concentration. How long are you able to hold your attention on your breathing before your mind is wandering? And if you find that your mind is wandering a lot, you can use these techniques not only as a means of helping to hold your attention on your breathing, but also using the techniques to get that balance in the autonomic nervous system, which is very, very important. And this can be measured via heart rate variability, increasing blood flow to the brain, stimulating the vagus nerve. And also when you have a feeling of air hunger, your mind is more likely to be anchored onto the breath. So I often say that, you know, people who are anxious, and 75% of the anxiety and panic disorder population have anxiety. Sorry, 75% of the anxiety and panic disorder population have dysfunctional breathing. And maybe, many of these people have tried meditation and they have tried mindfulness, but they're going to find it very frustrating, because if you have dysfunctional breathing, your physiology is in that fight or flight. So it's very important to use breathing exercise to bring a balance in the autonomic nervous system, in the balance in the automatic functioning of your body. And by doing that, your system calms down. And when your system calms down, it's easier to pay attention to the airflow coming onto your finger. So it's much easier to practice mindfulness when you have your physiology normal and when you have deep sleep. And deep sleep is really about breathing in and out through your nose. I spent 20 years breathing in and out through my mouth, waking up feeling absolutely exhausted in the morning, and going into school and university and required to concentrate and not being able to hold our attention. And of course, I'm not unique. There are millions of people in the same boat. We have to change our breathing patterns to change states. So coming back to long COVID, we use this exercise to stimulate the vagus nerve, to increase carbon dioxide in the blood a little bit, and the purpose being to achieve a lighter and slower breathing pattern. So in other words, for example, when I measure people's who are quite breathless and they have a low breath hold time, their respiratory rate could be 20 breaths to 25 breaths per minute. It's too fast. How do we bring down the respiratory rate? We bring down the respiratory rate by breathing less air, because when you reduce the ventilatory response to carbon dioxide, the respiratory rate naturally reduces. But if I just said to that group of individuals who are breathing 20 to 25 breaths per minute, if I just said to them, breathe in for 5 seconds and out for 5 seconds, the progress is going to be slow. And the risk is that as they breathe in for 5 seconds, I don't know how much air they are breathing in for 5 seconds. They could be breathing in very light, which would be ideal for 5 seconds and out for 5 seconds, or they could be breathing in this full big breath in for 5 seconds and out for 5 seconds. In other words, it's not just about the respiratory rate. We have to bear in mind the tidal volume. And if you just look at the respiratory rate and forget about the tidal volume, well, there's a huge piece of the puzzle being missed here. So coming back to this exercise, you have your finger underneath your nose as follows. You're paying attention to the slightly colder air coming into your nose and the really relaxed and a slow and gentle exhalation. And the very soft and slow, gentle breath coming into your nose and the really relaxed and a slow and gentle exhalation. I would like you to breathe out so slowly onto your finger, almost that if your finger was a feather, that the feather is not moving. So you can imagine an opera singer of old. They practiced with conservation of the breath. They would sing with a candle flame held about 8 inches from their face. And the whole purpose was to have such conservation of the breath that they could sing and project their voice with conservation, that they wouldn't blow out the candle flame. I need you to breathe out with such conservation of the breath that you feel hardly any air onto your finger. You're taking a very soft, gentle breath coming into your nose and a really relaxed and a slow and gentle exhalation. A very soft, gentle breath coming into your nose and a really relaxed and a slow and gentle exhalation. A very soft and gentle breath coming into your nose and a really relaxed and a slow and gentle exhalation. So with that exercise, you will be able to achieve that when your bolt score is probably about 13, 14, 15 seconds onwards. If it's less, you'll find it difficult enough to do. So you can always go back to the small breath hold exercise. So I'll just go through those again. If you're feeling that your breathing is just too suffocating and that you're feeling air hunger that's too strong, the best exercise always to start off with is the emergency exercise. We use it for people with asthma, people with COPD, and people with long COVID. Take a normal breath in through your nose and out through your nose, pinch your nose and hold. 1, 2, 3, 4, 5. Let go. Breathe in through your nose and breathe normal then for about 10 to 15 seconds. The breath hold is between 3 and 5 seconds, or no longer than half your control pause or your bolt score. And again, take a normal breath in through your nose, out through your nose, pinch your nose and hold. 1, 2, 3, 4, 5. Let go. Breathe normal for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold. 1, 2, 3, 4, 5. Let go. Breathe in through your nose and to breathe normal for 10 to 15 seconds. So if you are finding the exercise a little bit too difficult, do the small breath holds instead, mini recovery. So I'm just going to continue on to the next slides. So I just demonstrated there the breathing recovery sitting, and you're practicing this for 5 to 10 minutes, 3 times daily. We practiced at the start, we practiced hands on chest and tummy to develop air hunger. Recently, we've just done finger underneath nostril. And another exercise which is pretty good is hands cupping face. And the reason being is because it can help to pool carbon dioxide. Now, just bear in mind that if your hands are clean, if you feel comfortable cupping your hands, to do it as follows. And this is based on the old brown paper bag that used to be used if people were having a hyperventilation attack. If somebody was having a panic attack and their breathing is labored and they're feeling suffocated, they were sometimes told to breathe in and out of a brown paper bag. And the purpose of the brown paper bag is to pool carbon dioxide inside in the bag. So they're breathing out carbon dioxide from their nose or mouth into the bag. Carbon dioxide pools inside the bag. And then when they breathe in, they are carrying that carbon dioxide richer air back into their lungs, which in turn will increase carbon dioxide in the blood. And one note about carbon dioxide is that your blood circulation is influenced by carbon dioxide. So as carbon dioxide increases in the blood, your blood vessels dilate. So your blood vessels become wider and blood flow increases. And not only does blood flow increase, but oxygen delivery increases. So you've probably experienced this anytime you get into a stressful state and you start breathing hard and fast, and the next thing is you feel lightheaded. Why did you feel lightheaded? Well, that can be a sign that you've been over breathing. The more air you breathe, the more your blood vessels constrict and the less oxygen that's delivered. And that's why, for example, if you are practicing yoga or doing Pilates or doing many modalities, pay attention to your breathing. It's not always good to overbreathe. I know there's a point for stressor exercises when people overbreathe, but in the main, you don't want to be overbreathing, because if you're overbreathing, you're depriving your body of blood flow and oxygen, and you have 70,000 miles of blood vessels throughout the human body, and they are influenced by the volume of air that we breathe. So our breathing should be light, our breathing should be slow, and our breathing should be low. So this exercise is cupping your hands as follows. Now, try and have hardly any gaps between your fingers, and this is safer than the brown paper bag because oxygen can come in through your fingers. If you have a very low breath hold time, don't make any adjustments to your breathing. If you are making any adjustment to your breathing, just make sure to breathe in nose and slow down your breathing a little bit and breathe low. But if you have a breath hold time, a bolt score, or control pause of, say, 13, 14, 15 seconds plus, then breathe light. So the whole purpose of this exercise is you're cupping your hands as follows. For those of you with a low breath hold time, continue cupping your hands, but breathe in 2, 3, out 2, 3, 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 in, 2, 3, out, 2, 3. So for a low breath hold time, nice and slow, and maybe just bring it down to about 10 breaths per minute. If you have a higher breath hold time, you can do two things. We can practice breathing in for 5 seconds and out for 5 seconds, which is an ideal respiratory rate to help bring a balance in the autonomic nervous system. Because when you breathe in for 5 seconds and breathe out for 5 seconds, you are reducing the respiratory rate to 6 breaths per minute. This is helping to stimulate the vagus nerve, but also to strengthen the barrel reflex. And as you strengthen the barrel reflex and stimulate the vagus nerve, it increases your resilience. And it's very important that we as human beings, that we can go into stress, but also recover quickly. And that's resilience, that we can adapt to the environment. So you can help improve your ability to adapt to your environment by practicing this exercise. You can do it with your hands cupped. And I would like you to think of breathing nose, breathing slow and breathing low, and to breathe in 2, 3, 4, 5, out 2, 3, 4, 5, in 2, 3, 4, 5, out 2, 3, 4, 5, in 2, 3, 4, 5, out 2, 3, 4, 5, in 2, 3, 4, 5, out 2, 3, 4, 5, in 2, 3, 4, 5, out 2, 3, 4, 5. So just to continue with that. So as I said, the purpose of that exercise is to help stimulate the vagus nerve and to improve and strengthen the barrel reflex. But also an interesting aspect of that exercise is that it enhances alveolar ventilation. So by slowing down the respiratory rate, you can help to increase gas and improve gas exchange. I'm just going to mute, sorry there, 1 second. So I'm going to go back then to the presentation here. And we're talking about a bolt score of 10 to 15 seconds, and this will be your recovery, suggested breathing exercises. And we've been practicing these and teaching these breathing exercises for 20 years. And I've worked personally with about 8,000 people plus. So we have seen the results over the years. Breathing low can be a very good exercise for people with COVID as well, because of their difficulty in doing any of the exercises standing or sitting. And breathing low with your knees bent, and you're going to have your hands again at either side of your lower ribs, and breathing in very light and slow. In other words, you don't have to take a full big breath to engage the diaphragm. So when you are having your hands either side of your lower ribs, breathe in very, very softly. Because bear in mind, the air hunger signifies an increased carbon dioxide in the blood, which is very helpful. So it's about light breathing. Don't overbreathe. Best during the practice to breathe a little bit less air, slow breathing, gently slowing down the respiratory rate, that your breathing is a little bit slower than what it was before you started. And also that you have air hunger and low breathing. And I know that might sound, how do you bring all three together? But you can do it with practice. So we practice this here, breathing slowly in for 3 seconds and out for 3 seconds, practicing it for 3 minutes, 5 times daily. And again, a very gentle duration, because we don't want to tax the nervous system for people with long COVID. Humming with slightly a prolonged exhalation. And I would suggest maybe don't have a formal approach here, but whenever you think of it, take a very soft breath in through your nose and hum with a gentle and prolonged exhalation to help stimulate the vagus nerve. Use the nose unblocking exercise if necessary. And it's very important to get your mouth closed during sleep. Now, as your bolt score improves, you can spend more time doing the exercises. And the breathe light exercise is about generating that air hunger. So the first breathe light exercise we had was hands on chest and tummy, breathing less air, gently slowing down and softening the speed of your breathing to the point of air hunger. The second exercise we did was finger underneath the nose, taking a very soft breath in and a really relaxed and slow, gentle breath out. And you can also do the breathe light exercise with hands cupping face, breathing in very, very softly in through your nose and the really relaxed and a slow, gentle breath out, or breathing in light and slow for 3 seconds and out for 3, or breathing in light and slow for 5 seconds and out for 5 seconds. We spoke about breathing low, which is very important. You could be doing this for 5 minutes 2 times daily, and breathing slow, breathing in for 4 seconds and out for 6 seconds, or breathing in for 5 seconds and out for 5. They're quite similar. Breathing in for 5 seconds and out for 5 seconds has similar effects to breathing in for 4 seconds and out for 6. Both rates are bringing it down to 6 breaths per minute. So it's 10 seconds cycle of the breath. Humming with prolonged exhalation again, using the nose unblocking exercise and wearing the myotape during sleep. So you see that the exercise remained the same, but we are increasing the duration of it. And again, 20 seconds plus, breathing light, breathing low, breathing slow. And here we're having the person practice 30 minutes of breathe light, 10 minutes of breathe low, 10 minutes of breathe slow. So here you have 50 minutes, and we're looking to achieve to about 50 minutes to an hour daily. But this is not going to happen with somebody with a very low breath hold time. So when your bolt score is 30 seconds, when your bolt score is 20 seconds, now you can start pushing yourself a little bit because you're more resilient. But it can take a few weeks to get to this point. And again, bear in mind that you might take 1 step forward and 2 steps back. But your bolt score, improving the bolt score, is a really good sign that you're on the right track. You will notice the difference because your breathing is lighter and you have more control of your breathing. Walking for 10 minutes daily with nasal breathing, especially for those who are not susceptible to POTS, postural orthostatic tachycardia syndrome. And if you do have POTS, speak with your GP in terms of getting medication to help deal with the tachycardia. Because the tachycardia, of course, could bring on, naturally, it's going to bring on anxiety. Wearing the myotape during sleep. Now, if you want to read a little bit about it, one book is called The Breathing Cure, which is available internationally. There's another new book out called Atomic Focus. And then there's one for kind of sports performances called The Oxygen Advantage. So these exercises are available. They're available in different books. And there's also instructors, Buteyko instructors throughout the world, and also Oxygen Advantage instructors who will be able to help you if you have one-to-one. Because I think if, for example, I think it's best for people to have somebody to assist them on the journey and to hold their hands, especially during the relapses, because motivation can be a very important part of this. Keeping focused and staying on track, and what to do if, for example, you do get a setback. So reach out to an instructor who can work you through the exercise. I'm going to just see if Vikki Armstrong is present. I'm not sure if she's here. You are. Great, Vikki.
Yes.
And what I would like you to do is it would be great to get an insight. I'm not sure whereabouts you are in the room, Vikki.
Okay, I'm Vikki Jones. So I'm up here. So I'm just going to start talking. First of all, I want to thank Patrick because this is so scary for those of us that are affected by long COVID. And by him applying his expertise, we have tools now that can help us. And these tools have personally helped me. Long COVID is so different from anything any of us have ever experienced, because it is being driven by those suffering from long COVID. And we've never heard of this before. So I know all of you that have long COVID, it was something that didn't even cross your mind when you got COVID. So it's such a scary journey because you don't know what's coming down the road for you. You we all have very, very different symptoms that we have to deal with on a daily basis. So I think Patrick said that I actually got COVID back in July 2020. Prior to getting COVID, I was a fitness trainer. I used to be an international athlete. I considered myself fit and healthy. And COVID has really changed my life. I can no longer work. Finding things to help with the symptoms that I've experienced have been pretty much non-existent from the medical community, because, like I said, they don't understand what's happening to us. So the breath work I stumbled upon probably in March, and I read an article and started using some of the exercises that were suggested for people with long COVID, and they absolutely floored me. And it was the first time I'd actually met people with long COVID. So seeing people who were on oxygen, who were just lying in bed, who were sitting on sofas, and seeing the terror in their eyes when you're asked to hold your breath or to breathe in for 4 and out for 6. And we're all sitting there going, we can't do this. Even knowing that we were healthy people, and it's such a difficult thing to come to terms with. But when you start taking these things slowly, when you start implementing them on a daily basis in small quantities, you will feel improvements. And we're, like I said, I understand we're all suffering from very different symptoms, but you've got the symptom side of long COVID, and you've got the anxiety side of long COVID. So by using breath work, you can then marry the two and sort of help alleviate the symptoms or decrease your anxiety, because we all know I know it's scary. And talking to your partner or someone who is helping you through this, so that, yes, when you have anxiety time, you know to revert to breath work, because it will undoubtedly help you. So I know that some of these exercises seem minuscule. When I first started doing breath work, my Bolt score was 9. And I've now been doing it for 7 months, and my Bolt score is 19. So this is an improvement for me. I'm incredibly grateful for it, but it's not a linear progression. There are some days my Bolt score drops right back down, and I know those are the days that I need to back off. This is not like a training program. When we train people, when we do rehab for people, we give them a graded exercise. And this is not graded exercise. This is about pacing yourself. I don't even like the word exercise anymore. I use the word movement. You're moving in a different direction, because you are actually, you have to listen to your body with all of this. And I think it's something long COVID people have to learn. It's like, how am I feeling today? Have I got brain fog? Have I got symptoms? What's my control pause telling me is going on with my symptoms? Because it's almost an indication that you may be experiencing a little bit of a relapse when your control pause goes down. So those are the things that I keep an eye out for, but I do the exercise every single day. I get up in the morning. There's a Buteyko app that you can measure your control pause, and you can watch it every single day. I do that every single day. This whole thing about we don't understand what's going on with long COVID. But one of the things that I've looked into is that the long COVID has damaged our vagus nerve. So when Patrick was talking about the autonomic nervous system, our bodies are in this sympathetic, we are fight or flight the whole time, even when we're lying in bed, even when we're resting, our body from long COVID is in fight or flight. Our vagus nerve is damaged. So if you think of this breath work as a rehabilitation for your vagus nerve and do these exercises to improve your vagal nerve function and the strength of your vagus nerve, then you're going to be stepping in the right direction. And like I said, it's so slow. I've changed my breathing. I nasal breathe throughout the day. I nasal breathe at night now with using the tape. I talk to so many people about breathing and how important it is, because the other thing that I can't stress highly enough is this is your journey, and you have to find a way to get through the stress that long COVID unfortunately brings. And by taking control of your breath, to have something that you can return to in moments of stress, and also to heal yourself. I mean, if we were told that this breath work was healing our body, we'd all be doing this every single day. And as far as I know, there's nothing out there apart from, we've been told supplementation, we've been told so many different things, there's all the natural healing, the meditations. But you know what? It all comes back to your breath. It all comes back to your body chemistry. And this breath work is changing your body chemistry for the better. So that's kind of my little 2 cents worth.
Excellent. Vikki, thanks very much. And just to reiterate what Vikki was talking about via the vagus nerve, there are a number, all of the exercise that we practice today will help to stimulate it. So for example, the small breath holds at the very, very beginning will also help to stimulate the vagus nerve, because if you increase carbon dioxide, it has a vagotropic effect. The research over the last 30 years has also pointed that when you slow down the respiratory rate to between 4.5 and 6.5 breaths per minute, it helps to stimulate the vagus nerve. But the problem is that if you do have breathlessness and long COVID, you won't be able to slow down your breathing rate to between 4.5 and 6.5 breaths per minute. So that's why I said just do it very, very gently. The breathe light exercise, whereby you're really softening the speed of the air coming into your nose and a really relaxed and slow, gentle breath out, feeling air hunger, will help to stimulate the vagus nerve. You will have an idea of when you're activating the body's relaxation response by virtue of the increased watery saliva in your mouth. And normally when we have people breathe less air, once they don't go into a panic mode because of the air hunger. So the air hunger should be tolerable. And if you feel it's stressful, take a rest. But by breathing less air, and it stimulates the vagus nerve and it activates the body's relaxation response, you have increased watery saliva in the mouth. When we have increased watery saliva in the mouth, we know that the body is prepared for the digestion of food. So the increased watery saliva is for helping with digestion. So we are going into the rest and digest response. And as Vikki pointed out as well, that people with long COVID and also people who are long-term not well, either emotionally or physically, they can have reduced heart rate variability. And it's very important that we help to target the autonomic nervous system to help bring about that balance. Nose breathing during sleep is really, really important component to it. I'm just going to go through a couple of points of the last few points of the slides, and then we'll be kind of wrapping it up. And I'll stay for a few questions if any of you have questions. Dysautonomia is an impairment of the usual functioning of the autonomic nervous system. And again, it reiterates with what Vikki was talking about. And the autonomic nervous system, it controls your blood pressure, temperature regulation, and digestion. And dysautonomia is an umbrella term covering a host of different conditions, the cause of which, many of which have to be fully understood. And this is where that anxiety can come in, because, you know, individuals, their tests may come back as negative, showing that nothing is wrong with them. But yes, they know that something is wrong, but the causes and the issues are not fully understood. POTS, there was a question with regards, what is POTS? POTS is postural orthostatic tachycardia syndrome. And basically, if you were to stand up or sit up, your heart rate can increase by 30, 40, 50 beats per minute. So you have an exaggerated fast heartbeat from the minor physical exercise, an abnormal increase in heart rate that usually occurs after sitting or standing, and a connection between POTS and an inflammatory immune response in cases of COVID-19. Also, by stimulating the vagus nerve, it helps to control inflammation. And this was discovered by a neuroscientist back in 1998 called Kevin Tracy, that he electronically stimulated the vagus nerve in the rat, and it showed that it could stop inflammation. So that's why there also could be a connection here. And we looked at POTS there. So the symptoms from long COVID are too varied to be lumped together. And I mentioned earlier on that they closely resemble chronic fatigue syndrome, or ME. And in practice, they really, really do, because we had the same issues. And I made plenty of mistakes with people with chronic fatigue syndrome when I started working with them during the day, because I never realized that I had to go so gentle. And if I didn't go gentle, I would put them into fatigue. So exercise intolerance, profound fatigue, and symptoms are not textbook. And this is the unknown. In Mount Sinai Hospital, this was taken from, you see the link at the bottom, an article that was published in The Atlantic. All the patients had low CO2 levels when they first presented for treatment. And after practicing the breathwork exercises, symptoms abated. And the exercise at Mount Sinai would be breathing. Well, one of them is breathing in for 4 seconds and out for 6 seconds. In theory, it makes a lot of sense. But if you have a low breath hold time, you're not going to be able to do it. So what I would say is stick with the breathing recovery exercises. And with long COVID, they fall into two distinct categories. One is that symptoms could be directly attributable to organ damage during the acute phase of the infection or the complications of treatment. But the second group, they have persistent symptoms, even if they had just a mild initial disease. So they don't have organ damage, but yet they can have persistent symptoms. And hyperventilation basically means overbreathing, that when your breathing volume is greater than what you need, if you have a low breath hold time, you are more likely to hyperventilate. And people with a low breath hold time, and what I talk about low is that your breath hold time is less than 25 seconds. The lower your breath hold time, the more likely you are to breathe faster, upper chest, and breathe harder. And that will also reflect in harder, faster, and upper chest breathing during physical exercise. And it can also affect your sleep. So the symptoms from overbreathing include dyspnea, which is breathlessness, tachycardia is racing heartbeat, chest pain, fatigue, dizziness, and syncope, passing out. And in this paper here, I was looking at the arterial blood gases to characterize patients with long COVID. And they had, out of 81 patients, 19 of them had hypocapnia, low carbon dioxide, as compared to the remaining 62. And low carbon dioxide is when carbon dioxide is dropping below 35 millimeters of mercury. This is where the breathing exercise come in, because the breathe light exercise are about helping to restore normal carbon dioxide. And this is when you're doing your small breath holds, or you're breathing a little bit less air and you're feeling the air hunger. Now, on the ground, we have a report from a doctor in the UK, and he looked at, this was only about 2 weeks ago, arterial blood gases for the last 10 patients that he admitted with acute COVID pneumonia, all of whom had low blood oxygen saturation, but 10 out of 10 of them had low carbon dioxide. And he put the low carbon dioxide down to also fear and sympathetic activation. because of the anxiety that your breathing is harder and faster. And this is causing too much carbon dioxide to be removed from the body through the breath. Severe cases of long COVID, usually accompanied by obvious drop to blood oxygen saturation, but also carbon dioxide. And it's really important that we keep breathing under control. And nose breathing is the first foundation, but light breathing, slow breathing, and low breathing. Now, I just quickly go through a couple of papers here. This was one published by Messino, and he looked at the breath hold time of 57 individuals hospitalized with COVID-19 and 24 healthy controls without it, that if he got them to hold their breath for 20 seconds, that they had a greater average oxygen desaturation. So for example, take a normal breath in and out through your nose, pinch your nose and hold your nose for 20 seconds. And if your blood oxygen saturation drops quite significantly, maybe below 91%, certainly below 88%, it can indicate that conditions are not ideal. And the other aspect is that these individuals, and this was basically a hypothesis to test that adverse outcomes are independently associated with a greater average oxygen desaturation, but also a longer maximum breath hold duration. Now, again, if you have breathlessness, don't hold your breath to the point that you lose control of your breathing. So I'm just bring it to the last slide, and then I'll go to some questions. And I just like to say there were a number of people who contributed to this presentation. Dr. Ella from Poland, who is working with long COVID patients, Vikki Armstrong, who I'm really grateful for her insight, but also for talking, because I think it's tremendous to have a personal experience to try and piece information together. Dr. Colin Spate from the United Kingdom, Peter Lakatos from Hungary, Sean Flott from the United States, and Bob Solera, and for their contributions in terms of the information that we put together. Of course, there are still unknowns and we don't know all of the answers, but what we are looking at is in terms of simple breathing exercises, just to help to bring about some control. And really, that's what it's about. I'm just going to look at the chat and just for a few minutes, and then we'll kind of wrap it up, and I'm not sure how many questions I'll get through. And I'll just bear with me 1 second here. So I'm going to kind of just to bring it together as well. As Vikki said, don't expect your progress to be in a straight line, but at the same time, practice the exercises a little bit often. And you'll never go wrong with the small breath hold exercises. Breathing in, out through your nose, holding your nose, and holding your breath for 3 to 5 seconds, and then breathing normal for 10 to 15 seconds. And then breathe in through your nose, out through your nose, and hold your breath for 3 to 5 seconds, and then breathe normal for 10 to 15 seconds. And do that for 3 to 5 minutes every hour. Or if you feel comfortable, do it for 5 to 10 minutes every hour. But just to bear in mind what Vikki said, that when you finish the session, you should feel enough energy to do the session again. The breath hold exercises are the mainstay, and breathing in and out through the nose, and of course the mouth closed at night. I will just show you the Myo tape, because just in case some of you are wondering, how on earth could you get your mouth closed at night? We use a tape that surrounds the mouth, and the name comes from myofunctional therapy. So Myo tape, it surrounds the mouth as so, and it brings the lips together with elasticated tension. And this way then people can be breathing in and out through their nose, but they don't feel the apprehension of putting the tape across their lips. I would also say that if, for example, you're overly breathless during sleep, don't lie down. You're much better off sleeping in an incline, whether you elevate the bed or whether you put pillows or something behind you, or whether you sit and sleep in an armchair, because if you're elevated, your breathing, you'll feel a little bit more control of your breathing. If you've got labor breathing, lying down can be quite taxing. The next aspect is when you feel comfortable with a little bit of control of your breathing, always be aware of your breathing and try not to be heaving using the upper chest. And this is kind of normal when your breath hold time is so low. Always think of the mantra, no, slow and low. You may not do it perfect, but the more you can slow down your breathing, the better. And also the more you can breathe low and having your hands either side of your lower ribs as opposed to on your abdomen. So having your hands either side of the lower ribs, and as you breathe in that the ribs are moving out, and as you breathe out that the ribs are moving in. And it's all relative. Even if you can slow down your breathing a little bit, it's positive. Even if you can reduce your breathing volume a little bit, it's positive. And if you can breathe a little bit lower, it's positive. So don't worry about getting it perfect because it's going to be relative to your bolt score. Practicing it is going to depend on your bolt score as well. The duration, 3 to 10 seconds, maybe do about 3 to 5 minutes every hour. 10 to 15 seconds or 10 to 20 seconds, you could increase it 5 to 10 minutes every hour. And by doing it consistent, we want to improve breathing patterns, but we also want to influence the autonomic nervous system. And sleep is going to be a component of that as well. If you feel comfortable doing some exercises standing up when you have a higher bolt score, go for gentle walking with your mouth closed. And now what I'm going to do is just have a quick look at some questions. I have a deviated, is a recording of this. Yes, the recording will be put up on YouTube. And that's why I didn't really include anybody. I just kept the screen and the presentation, but you will find it on YouTube. When I started learning how to breathe, I noticed that I'm clenching my stomach. That made it difficult to do diaphragmatic breathing. So the whole aspect is to have very gentle breathing with a relaxed area around, the whole tummy area should be relaxed. The chest should be relaxed. There is a relaxation MP3 that you can download from the Buteyko Clinic app. And it's a 20-minute guided breathing exercise to help just to bring you into relaxation. And the thing about the breath is, it's not about putting in effort. It's about just focusing your attention on the airflow coming in and out of your nose and just gently slowing down your breathing, slowing down the breath. So it's just gentle doing it and bring in relaxation with it. And the other thing is that when you are working with breathing exercises, not to deliberately interfere with your breathing muscles. Sometimes people with perfectionist tendencies, they can put in too much effort.
Patrick, can I
Yes.
say something?
Yeah.
It's Vikki again.
Vikki, hi.
I was just going to say, if you are new to this, it is going to feel very uncomfortable because I think one of the things is when we came into COVID, we were probably dysfunctional breathers. So not only are you learning to breathe again, but you're also, and I've got brain fog, but you're also, it's a difficult thing to do. I'm not finding words. And sorry, this is long.
So you're trying to change a habit. You know, you're trying to change old ways as well as and you know, I can totally understand it. I can, even though I touch wood, I haven't experienced it, but I can really, really get it. Vikki, I think we're going to draw to a close just in terms of time, and I'd like you just to have the final words.
Yeah, like I said, this is going to help, and I cannot thank Patrick enough because this has, you know, saved me. I've had some very difficult moments during long COVID, and you know, it's a little and often. It's going to feel strange at the beginning, but you're teaching your body a new habit, a new healthy way to deal with anxiety and hopefully alleviate some of your long COVID symptoms. So do not overdo it, take it slowly, and hopefully you will all find some helpful movement in the right direction, you know, to better health.
Thanks so much, Vikki. Franz, I just let you in because we're going to draw to a close.
Thank you. There's just one little addition. I think building a new habit after having breathed so not naturally, I think it's just very wise to find an instructor, a coach, or whatever, an Oxygen Advantage instructor to help you along this path, because it's a lonely path, and it's sometimes you just need someone. And I think it's good when you go to the Oxygen Advantage site and find yourself an instructor. And that's all that I wanted to add to it.
Okay, I think it's a good point as well, and Buteyko Clinic as well. Thanks very much for joining, everybody. I hope that's been of benefit, and to say good evening to everybody. Take care. Bye.